essentially Temple and Temple Lung Center had already had a well-designed single visit screening modality. And when the COVID-19 pandemic kind of was in full force in Philadelphia, we had to halt screening for about a month. And Dr. Erkmen and her group were able to quickly put together an alternative in a single-based visit telemedicine-based modality that was able to screen patients for lung cancer screening while minimizing the risk of exposure and minimizing the resources that we were using for the lung cancer screening. So once the telemedicine-based platform was kind of fully functional and a few months into screening, the next question was whether it was as effective as the in-person screening, and whether this was something that we could continue beyond the pandemic or whether it was just something that needed to be done as a temporary basis. The telemedicine-based screening is still being used, and our conclusion was that we were still able to screen similar demographics as our in-person based screening method, and screening the majority African-American patient population, which historically and in previous literature has been underrepresented. I think an important feature of this study is that it addresses a known need in terms of healthcare, that lung cancer screening has been low for decades, and it's something that we've continued to try to work to address. But I think it's also applicable to other fields and to other screening needs.
And I think it's important to realize that it doesn't have to be one or the other, in-person or telemedicine, that we really are nationwide only screening 3 to 6% of eligible people. So there's a huge missed opportunity to decrease lung cancer mortality in the United States, and we're not taking it. So what can we do to offer lung cancer screening to more people? What can we do to engage more high-risk individuals in screening? And so whether it's in person, where you have your CT scan and you meet your physician face-to-face and that's better, or if it's better for you to just get the screen, go home and have a telemedicine visit, it doesn't matter. We just need to get you screened. So moving forward, even though telemedicine has proven to be helpful during a pandemic, that we should really be looking at all different means of engaging patients, and maybe even a combination, whatever it takes. We need to get more people screened.